Hello everyone, you are watching Blackboard and welcome to our hematology playlist. In the previous video, we have discussed about various blood collection tubes and their additives. You can find the link in the description bar. So, today's topic is alternatives of blood collection tubes. There could be certain reasons when someone does not find the actual vial for the required test. Isn't it problematic that you can't perform your test? Now, what could be the solution of that problem? There are certain alternatives of blood collection tubes which can be used for certain tests. If you don't have a yellow vial for chemistry testing, you can perform certain tests in different vials. For example, in EDTA vial, you can perform renal function test, liver function test, lipid profile, ALT level. But tests that can't be performed in EDTA are electrolytes, as potassium would be high and calcium would be low. ALP level would be low in EDTA. Now, the second vial that can be used as an alternative of yellow vial is sodium citrate vial. Chemistry tests that can perform in citrate vial are liver function test, renal function test and glucose level. But if the sample plasma is separated immediately, then glucose is not affected as much, as glucose levels fall 7 to 10% during first hour if the glycolytic inhibitor is not used. Means you can perform glucose level in any vial if you separate the plasma during the first hour of sample collection. There are certain chemistry tests which can't be performed in citrate vial as electrolytes. Sodium levels would be high, which will alternate the test results. Fluoride oxalate vial can be used as an alternative for chemistry testing. Liver function test, renal function test and cholesterol levels can be performed. But urea level would be low and electrolytes, sodium would be high and calcium would be low, so you can't perform these two tests in this fluoride oxalate vial. In case of emergency, when someone needs urgent results of certain tests, he or she can perform their test in the EDTA vial for immediate test results. There are certain possible errors that could be occur during blood collection. The most likely error in the blood collection is hemolysis. What could be the reasons? If you tie the tourniquet for more than 1 minute, this will cause to plasma ooze out from the vessels and heavy cells remain concentrated in the veins, which will come with the pressure, hit the wall of the syringe and will break. Mismatching of the gauge of needle and vein bore size. It means when you are using small gauge needle for a larger vein. Pushing sample in vacuum with pressure. Vigorous shaking of vial. Extreme of temperature. Immediate centrifugation without waiting for the clot to form. Hemolysis will affect certain test results. Due to the breakdown of RBCs, contents of the cell will come outside and causes the disruption of certain test results. Potassium will be high, phosphate will be high, CK will be high, AST come outside from the RBCs and high, LDH present from due to the breakdown of the RBCs it will high, calcium as phosphate come from the RBCs and chelate all the calcium, so calcium would be low and sodium also will be low. The second most common error during blood collection is clot formation. Clot formed when the coagulation factor within plasma are activated. Clot will form immediately in syringe if the blood is not exposed to anticoagulant. Clot within the specimen, even if not visible to naked eye, causes inaccurate results. Causes of clot formation. Inadequate mixing of blood and anticoagulant. Anticoagulant helps in the prevention of the clot formation. Delay in expelling blood within syringe into a collection tube. As longer the time the blood remains in the syringe, more the chances of the clot formation. Third possible error of blood collection is insufficient volume. Short draw results in an inaccurate ratio of blood to anticoagulant and yield inaccurate results. Causes of insufficient volume. A vein collapsing during phlebotomy. Now you are unable to collect a proper blood sample. Needle coming out of the vein before the collection tube is filled. Loss of collection tube vacuum before the tube is full. All these causes results in the loss of the test results. Fourth most common error is labeling error. If it is detected, the incorrectly labeled specimen will be rejected. If undetected, it will produce incorrect results. Causes of labeling error. Failure to follow proper patient identification. Failure to label the specimen completely and immediately after the collection. So, this is very essential to label the specimen immediately after collection in order to provide the right results for the right person. This was all about from today's video. Thank you for watching. Hit the like button, press the bell icon for more updated videos. Bye bye.